I call the honourable member for Denison.
Thank you, Madam Speaker. My question is to the Health Minister. Minister, another aspect of the government's miserable budget is an investigation into the sell-off of Australian hearing. This greatly concerns the clients of the Australian Government Hearing Services program, for example, the hundreds of deaf and hearing-impaired children in Tasmania. Minister, what reassurance can you give those people that there will be no sell-off, or that if there is, there would be no adverse effect on the delivery, scope and cost of services?
I call the honourable Minister for Health.
Well, thank you very much, Madam Speaker, and thank you very much to the member for Denison for his question. And as he points out, the government has announced a feasibility study in relation to Australian Hearing Services, because I want to make sure we are getting money away from bureaucratic services and back to frontline services, including and in particular in hearing, as the honourable member refers to. And
the member for
the
Ballarat.
honourable member makes mention of the budget. In this budget, we increase spending in health in each of the years in the forward estimates. We increase health spending and hospital spending. Hospital spending goes up by 9% next year, the year after and the year after that, and 6.5% in the year after that. So we have provided a lot of support to frontline services, Madam Speaker, in this budget, and we are very proud of it. Now, the Labor Party did preside over this great mushrooming of bureaucracies within the health portfolio over the course of their 6 years, and we want to make sure that we can get money back to doctors and nurses and deliverers of health services so that we can get more patients seen. That is the desire of this government, and, Madam Speaker, that is what we achieved. Now, the member for Denison was able to broker an arrangement with former Prime Minister Gillard in relation to a hospital within Tasmania. Unfortunately, much of that money was spent and the hospital was never built. That is the difficulty that Labor presided over. They spent enormous amounts of money away from frontline services. The contrast could not be starker, and we will provide additional services to the Australian public because we will not waste money on great big new Labor bureaucracies.